researchers have started to talk about. So PTSD is, but post-pandemic stress disorder is a label or a name that we've given it. So I suppose why is this important? I mean, given the invisible nature of a pandemic, people may see trauma minimized, whereas an event like a world war or a war may normalize trauma. So it's really important that we start some conversational narrative around this, or at least bring to our awareness what the effects of a pandemic may bring and the associated risk factors. So PTSD following pandemics is a significant public health concern, as well as the associated risk factors. And given also it's Mental Health Awareness Week, I think this is an ideal opportunity to do this presentation. So in terms of, I'm just thinking, how do I? Just trying to move on to the next slide. It doesn't allow me to. Okay, so outcomes. By the end of this presentation, I'm hoping that you all have some idea of what post-COVID-19 stress disorder is, the stresses associated with it, interventions and ways to manage it, some research, protective factors or ways to prevent it, where we can seek help. And I guess what was interesting for me is whether post-pandemic trauma should be recognised as an official disorder, or whether we think it's just another label, and how helpful, if anything, it will be. And I guess that will also prompt some nice Q&A discussion. So what is PTSD? So the DSM-5 has recognised it separate from, I mean, the DSM-4, it recognised it as an anxiety disorder, but since then DSM-5 has given it a separate, if you like, diagnostic trauma that comes under trauma and stressor related disorders. It's a normal reaction to an abnormal situation, and it's a condition whereby people, it's a condition that people develop after experiencing or witnessing a traumatic event or a serious injury. People with PTSD have intense, disturbing thoughts and feelings related to this trauma after it has ended. So that's really important to bear in mind, because as we move from the acute stage of the pandemic, we've got to be watchful of, I suppose, symptoms and what people may experience after the event. So in relation to the pandemic, groups that have met the DSM-5 criteria for post-COVID stress disorder include those who have themselves suffered from serious COVID-19 illness and potential death, given the kind of prolonged, I guess, stress and fear that they've experienced. Individuals who, as family members and healthcare workers, have witnessed others suffering death. Individuals who have learned about death or risk of death of a family member due to the virus. And individuals who have experienced extreme exposure to aversive details, and that's journalists, medical examiners, hospital personnel. Oh, sorry about the spelling, it's personnel. So what symptoms are we looking for? Increased level of fear and anxiety insomnia, mood swings, so that can range from feeling very numb to anger, frustration, nightmares, obsessive compulsive disorder, so possibly frequent washing of hands in order to stop the spread of the virus, or constantly checking for checking doors, etc. Those who have been isolating for a long period, ruminating, that is going over certain thoughts associated with either losing control or the virus, or worried about our loved ones. Hypervigilance, so possibly, example of this might be, feeling really fearful that every time you step out, go to a supermarket, that you might contract the virus. So whilst we all need to be hypervigilant, this is something that is disproportionate to what's going on. So it's extreme. And feeling hopelessness. So these are just some of the symptoms associated with post-COVID-19 stress disorder. So what are the traumatic stresses associated with the pandemic? Severe illness, so those who have been to hospital or have had to have required some intervention, as I've just said, witnessing death of loved ones, extreme exposure to COVID-19 details. General stresses associated with the pandemic include COVID-19 exposure or quarantine, having to socially isolate, which we've all experienced, employment, income loss, working from home with kids and adjusting, being a caregiver, making difficult medical decisions as mental health professionals, inadequate PPE. And also, I guess what I haven't got on this list is people started talking about moral injury. And that is, for example, doctors feeling extreme guilt for not being able to save those that are experiencing, extreme forms of COVID-19. And I've got some examples from friends that are anaesthetists who have shared details of patients that they've lost, and in terms of not being able to feeling just hopeless. So how can we help individuals whose mental health has been harmed by COVID-19? So thinking about interventions, and I guess it differs to, I suppose, groups that have been exposed to COVID-19 and possibly the contact that you have. So medical caregivers assigned to the front line during the pandemic, experts advise thinking about burnout, problems with overlap and can lead to stress disorder and PTSD. So working long hours, or like on the wards we experienced when wards were turned into some COVID-19 wards, feeling fearful of having to go on to these wards. Practical measures, so that includes, I guess, thinking about staff and thinking about, well, do we need to help out with childcare, and you know, I guess again, practical measures will differ from workplace to workplace, and also I suppose how the pandemic affects you individually. Developing personal policies, self-care. I've just mentioned access to childcare services, telephone and hotline teams or wellness programs. I know on the wards we started to develop psychological first aid for staff, either at the end of shifts or beginning of shifts, also using things like reflective practice. Those ill from COVID-19, I suppose some sort of assessment for physical symptoms of chronic pain. I know that some people recovering from COVID-19 have still not been able to go back to their full health. And I think, you know, not being able to have a conversation around that, or being, you know, if people aren't talking about it, you're I guess alone thinking about, well, is this normal? Is this not? How comes I was able to tolerate, you know, exercise or this many hours and now I can't, or feeling really fatigued. I know some people have reported some neurological difficulties as well, and there's been talks of long COVID. Survivors who have recovered from acute respiratory distress syndrome, thinking about interventions to help them, because I mean, if you've been struggling to breathe, that can create, I guess, once you've passed that period of recovery, you can develop panic disorder or a fear of not being able to breathe again. Combat isolation in nursing homes. So this EMS recommends safe communal activities. So having lots of activities that are stimulating. I mean, especially the elderly being at risk, and social isolation being a risk factor. Self-help groups. The 12-step program. So what we haven't, some people have not talked about is some people have, there's data shown that substance misuse has increased. People have been using that as a coping strategy. So any kind of 12-step programs, spiritual and religious services, interest groups, and assistance with survival needs. I know that I had a conversation with James about, you know, I guess recognizing that some people, either as a consequence of a death of a loved one, of now having to sort of cope with practical day-to-day activities that they've not had to do, such as taking cars for services, etc. So I think the assistance of sort of survival needs is so important. The next thing I wanted to move on is research. So I think this is very important because it also informs the things that may act as protective, and things that maybe we can learn from and capitalize on. So resilience is known as ability to adapt to trauma or extreme threats, and it's essential part of coping and adjustment experience in trauma. So a study of nurses in China exposed to COVID-19 found that that those with the highest scores in avoidance symptoms had, you know, they had greater, they had less job satisfaction and were associated with lower PTSD and coping strategies. So this is evidence for that resilience is so important, and also having positive coping strategies. In a study of home quarantine youth in China, they found that 12.8% had symptoms consistent with PTSD. And those that had PTSD had negative coping strategies. And also what was important was quarantine length. So as quarantine increased, that became a greater risk factor. In Spain, they found, an online survey found symptoms of PTSD in 15.8%, and depression in 18.7% of a population that participated, and anxiety 21.6%. With loneliness being the strongest predictor. Other factors that have been found have been being a female. So interestingly, females have a greater propensity to experience PTSD symptoms than men. So studies have shown that, have reported on those that have investigated disease outbreaks, that disease outbreaks has a higher effect on women than men, identifying women at a higher risk of developing PTSD than men. I mean, the study went on to look at why this may be, and it was found that women had greater brainstem activation. So when they experience trauma, they would react negatively to it, whereas men had they were able to contextualize fear better than women. So that's quite interesting. It's kind of the contrary to sometimes where we might identify men as maybe not being so open and to talking about their difficulties at a greater risk. If you've had a previous mental health condition, you're at greater risk, and also other physical symptoms. Social isolation is particularly a risk factor associated with the elderly, and it's found that the depression, anxiety, and there's been reported worsening of dementia symptoms and even earlier death. So protective factors and ways to prevent. I think it's very important that we have a good social support network around us. And I'm just going to, I mean, maybe this can stimulate some Q&A discussions, so I won't talk at length about some of these factors. Financial stability and employment is also a protective factor. Healthcare resources, a safe workplace, wellness programs that look at the psychological, I guess, protective factors of their staff and risk of burnout, adequate PPE, promoting diversity, and timely COVID-19 testing. So where do I seek help? I think it's really important that, and I guess this will also feed into whether, you know, post-pandemic stress disorders should be recognised as a label in itself, and whether that discourages people from seeking help. I think having a good, you know, family and friends are an important source. It's interesting. I was part of a group in sort of part of a group that formed that was made up of Indian doctors and some UK doctors. And the Indian doctors were saying in India at this present moment, because it's in a very acute state at the moment, COVID-19, that people who were relying on friends and families, they weren't an adequate source because they were already burnt out. And also people were sort of thinking, well, why are you telling me, because I'm already going through this, and what? So it's I guess we've got to kind of think about whether, you know, that's I guess appropriate or not. But friends, workplace, so finding adequate support and I guess highlighting to managers or people whom you trust in the workplace. I think place of worship. During my, once I was facilitating lots of reflective practice, I was asking the nurses, you know, where they were gaining or getting support, and a lot of them said that the church communities that they belong to, obviously GP and places like the Samaritan or other charitable organisations. I want to move on to I guess some important questions. So should post-pandemic trauma be recognised as an official disorder? As I started talking in the beginning, it's not a disorder that is recognised or is in the DSM. PTSD is, but not post-pandemic stress disorder. So is a new name like post-pandemic stress disorder needed to describe this pandemic-related trauma that people are facing? Having a name that is not too dissimilar to another disorder, I mean, do you think that it may lead to difficulties later on in terms of distinguishing between the two? So what's the difference between PTSD and post-pandemic stress disorder? Could labeling it prevent people from reaching out for help? Or do some just think it's just another label? And how helpful is this? So yes. So that's the end of my PowerPoint. I hope I didn't rush through it.